According to the Mayo Clinic, approximately 26 million Americans suffer from kidney disease. This statistic is extremely alarming. Unfortunately, kidney disease affects patients of all ages. As a kidney transplant certified nurse, I am going to discuss with you the process of being listed for a kidney transplant on the National Registry. First, it is a lengthy process to be evaluated for a kidney transplant. The process is important to make sure that the patient understands the process and that a transplant is conducive to their everyday living. Nonetheless, there is an extensive diagnostic workup to ensure that the patient is healthy enough for a transplantation. Physicians need to rule out any underlying unknown diseases to make sure there aren't any complications during or after the surgery. Initially, a lot of blood work is drawn. The patient's blood type needs to be known to ensure compatibility of a new organ. If a patient were to receive a new kidney of a differing blood type, the patient would experience life-threatening side effects. After the blood type is known, more blood work is drawn to assess blood cell count numbers, electrolytes, and vitamins. The patient needs to be as healthy as possible before the surgery to prevent complications. Next, the patient is required to have a diagnostic workup of the heart. Surgery and anesthesia is very difficult on the body. It is crucial to learn about the patient's cardiac status to make sure that they can sustain a surgery. Physicians will order an electrocardiogram or an EKG. The EKG essentially assesses the different electric conductivity of the heart to make sure that it's pumping like it should. After an EKG is performed, a chest X-ray will be performed. The chest X-ray further visualizes the heart, but it also looks at the lungs. Again, surgery and anesthesia is difficult not only on the heart, but on the lungs as well. During a kidney transplantation, the patient will be intubated with an artificial airway. An artificial airway essentially is a tube that will be placed through the trachea and will breathe for the patient during the surgery, and it is very important to make sure that the lungs can sustain. If anything atypical is noted on the blood work, the EKG, or the chest X-ray, further diagnostic tests will be ordered to evaluate the abnormality. Furthermore, at the University of Pittsburgh Medical Center, UPMC, a variety of doctors will be consulted on the case of a potential kidney recipient. Patients need to be prepared for many doctors' visits. These consultations essentially will deem whether or not the patient is a transplant. First, a nephrologist will be consulted. A nephrologist is a kidney specialist who will look into the patient's medical history and the current reason as to why the patient's kidneys failed. They will develop a plan of care. After that, the transplant surgeon will be consulted. The surgeon will discuss the surgery in general and the recovery process. After that, a nutritionist and dietitian will evaluate the patient's current nutritional status to ensure that they are eating all of the food groups and to make sure they are as strong as possible before surgery as well as after surgery. After that, a social worker is consulted. The social worker will look into insurance coverage. It is very important that the patient has some sort of coverage because the surgery itself and all of the medications that are mandatory after the surgery are very costly. If anything isn't covered by the insurance companies, the social worker can look into further financial assistance. Other than the insurance coverage, the social worker will evaluate the support system. These patients go through a lot before, during, and after the surgery, and it is essential that they have support to help them recover after the procedure. Patients can't do this alone. Finally, the patient is assigned a kidney transplant coordinator. The coordinator is available 24 hours a day, 7 days a week to the patient and family to answer any questions, comments, or concerns. The coordinator is the first person, other than the doctor, to know whether or not there is a potential organ. Therefore, the coordinator will call the patient when they first learn about a possible transplant. So, as you all have learned, it is a very lengthy process to being listed for a kidney transplant. A patient has to have a lot of blood work drawn, an EKG, chest X-ray, and meet with a variety of medical professionals to make sure that they are a good candidate for a transplantation. I have had the honor of caring for patients both before and after their surgeries and have seen the many successes that these patients experience. They're basically offered a new opportunity at life. For all of you non-medical professionals, I hope you've learned a little bit about the process and have a new understanding and idea for what goes into receiving a kidney transplant. I thank you for your time.